I've been, I think like most people, pretty lucky. Not a lot of experience with the healthcare system yet. You maybe have children who break a bone, you maybe get a cold, you have to go to your doctor. All of a sudden you're talking to people who work in emergency care, who are contending with people who are elderly, frail elderly Canadians who also have dementia, and you're talking to the people who triage them, and you're talking to the people who deal on a daily level with the sort of ravages of dementia. One of the many things that was surprising was that was not all sad, right? It doesn't mean that the doctors and the nurses and the other workers weren't fully aware that what they were contending with was not something that anybody would ever want. They were fully aware of that. But there was joy there. And they talked about the patients themselves who were able to find their own joy, and the caregivers who were able to laugh with their mothers and fathers as they came in, that there was still real life, there. And I think maybe for those of us who are not facing dementia, that is a surprise, that you think the diagnosis comes down and your life goes a bit dark. A particular neurologist who owns a memory clinic here in Toronto, and she was talking about her own family experience. She's a grandmother, died of dementia, with dementia. She has a second grandmother who died of a heart attack but had been diagnosed with Alzheimer's. And this woman who owns this memory clinic, her mother lives with her now, and her mother has Alzheimer's disease and it's fairly far advanced. And this doctor talked about how this is the gift and the grace of life, that it's her responsibility now to take what her mother has taught her over the decades and to take care of her mother's needs, but also to look at this disease as part of her mom's progression and part of who she is. And so let's make your life comfortable and say, isn't this wonderful that you are here and this is just part of you. But then she goes to the office during the day, and her role is to help people define their diagnosis. What kind of dementia are you dealing with? How do I manage your symptoms? How do we interact physically so that you get some kind of therapy happening with your caregiver in the room? She just was like, this is not a fatal, final diagnosis. It's just a new stage of your life. And I wasn't expecting that with her. It was lovely.